Hi there, Dr. Cary Yurkiw here. I'm a chiropractor in Kelowna. Today I'm talking about stretches for dental health professionals. Now, dental health professionals tend to be affected in the neck and the shoulders more than anything, and it's usually due to poor posture and repetitive strain injuries. What I mean by that is usually dental professionals are working on one side of the table with the patient, twisting their neck and their shoulders one way, which causes rotation of the vertebrae, and then the nerves start to get pinched on one side. And this can refer pain down into the shoulder and down the arm. It can also cause muscular imbalances because when you have misalignments in the neck and upper back, the muscles on one side have to shorten, and on the other side, they have to lengthen to accommodate for the position of the spine. So depending on which side of the table you work on and the alignment of your neck and shoulders, certain stretches are going to be more effective than others. And this chart is from the teethtalkgirl.com. And I really like these stretches. These shoulder blade stretches in general are good to do, just putting your hands behind your back, stretching out the shoulder blades, contracting them together as you do this, and then rolling down, which is kind of the opposite of the shoulder blade stretch. Now you can do these in between patients or on your breaks, 3 to 4 times a day. And it only takes a few minutes to do these. And it's good to talk to your health professional, your chiropractor, before you do these, just to know which ones are best for you. The ear to shoulder is good, just putting your hand on the opposite side and then stretching the ear to the shoulder, helping the muscles to stretch on the opposite side. And then of course do both sides, do the other side as well. Spinal twist is good, just sitting in the chair, reaching back, twisting the spine. You don't want to force it too much because it can start to crack your back, and it's not good to force and crack your back. If it pops just by stretching, that's okay, but don't force it. These are more for the hands, the opening and closing, because sometimes the wrists get tight and we see carpal tunnel in the clinic because of pressure on the nerve right in the wrist area. So opening and closing the fingers to stretch them out, lifting the back up overhead and arching the back like this is good, holding for about 3 to 5 seconds, and doing this, I would say 8 to 10 times if you can. And then the back stretch, this is more for the low back, just standing up, arching the back backwards. The thumb stretch, because the thumb muscles are used differently than the finger muscles, that can be very good as well. And then the wrist flexor and extensors right here, stretching the wrist. Now, in addition to that, there's a few other stretches that I really like. We already went over the side bends. The wingspan is good, just trying to reach up over your head with one arm, behind your back with the other, to touch the hands together, do the other side. Neck rotations are really important because I find a lot of hygienists and assistants twisted with their neck to one side. You definitely want to twist the opposite direction, hold that for 3 to 5 seconds, and then repeat that for 8 to 10 times. And if you have enough time, do both sides. Shoulder shrugs are good too. As long as you're not getting any pinching in the neck, shrug the shoulders up towards the ears, hold that for 3 to 5 seconds, relax. Take a deep breath, do it again. I would say doing this 8 to 10 times is good as well. The forward and backward bend, we already went over that. The rotations, we went over that. I do like the cat and cow stretch where you're on all fours, you're arching your back and your head up, then you switch to arching your back forwards and your head down. And switch between these two postures, pausing for 1 to 2 seconds in between. Do this 8 to 10 times. It's a good general stretch and mobilization for the spine. If you have any questions, let me know at your next session. If you're looking for a chiropractor in Kelowna, we are accepting new patients. And if you don't live in the area, you can comment below or DM me. I'd be happy to find you a chiropractor in your area that can help you. Please like this video, subscribe to the YouTube channel, and follow me on social media.